So today I'm going to speak to you about female intimate health and how it's growing as a specialty, and also talk a little bit about my experiences with some devices from BTL, namely the HIFEM 360 and the Emsella Chair, and how I'm using them in my clinic to help my patients. And there's been quite a lot of interest around female intimate health, and it is an area that is growing in demand. I think what I'm finding is that women are now willing to speak about their issues more, and they're more willing to come forward and seek treatment for the problems they're having. I think the reason they're coming to us as aesthetic doctors rather than going to their doctors is traditionally there's been a reluctance for women to speak to their doctors about their situation. They've also had issues with having their needs met by health services in general, particularly in the UK. The NHS doesn't have the resources to address the issues that women have. And some of the treatments that have traditionally been provided to these ladies have been lacking in safety and efficacy as well, or they've got too many side effects. So the kinds of reasons that women are looking for treatment for intimate health could be things like dissatisfaction with the appearance, but there are also many functional reasons why women come for help. For example, problems related to childbirth, problems related to ageing and menopause. There could be issues with sexual dysfunction, or there could be dermatological concerns with the genitalia. So, for example, the range of conditions I'd see in my clinic could be things like loss of volume from the labia, stress incontinence, vaginal laxity, vaginal atrophy, which is now called genitourinary syndrome of menopause. So there's a whole host of problems that women do actually present with. In terms of treatment options, historically all that was available to these women was either surgery or pharmaceutical methods. But I think we're in a really exciting time now where there have been so many developments recently in our field that there are so many more treatments we can offer, fillers to PRP to plasma treatments, and there's a whole host of energy-based devices that we have available to actually achieve life-changing results. The Emsella Chair is the latest addition to the clinic in terms of pelvic floor treatments, and it's a really exciting treatment. It uses HIFEM technology, which is high-intensity focused electromagnetic technology to actually stimulate the muscles of the pelvic floor. So what happens in a treatment session is the patient sits on the chair fully clothed for 28 minutes, and they actually get over 11,000 pelvic floor contractions during that time. What's different between these induced contractions compared to what a patient can do by themselves is that because you're taking out the brain and you're directly stimulating the muscle's actually contracting to 100% of its ability. So the overall result on the strength of the pelvic floor is phenomenal. Patients come for treatments either 2 to 3 times a week, and they have a total of 6 in the initial course. And this is followed by maintenance once every 2 to 3 months. Again, feedback from my patients has been absolutely incredible in terms of managing all types of urinary incontinence. So the feedback I get is that by the time they finish their course, they have a noticeable improvement, and not one person has said that they haven't had any change. So the Emsella Chair is absolutely fantastic at treating the muscles in the pelvic floor. And it takes out the human element because, let's face it, none of us actually get round to doing our pelvic floor exercises. So it's a brilliant way of stimulating the muscle and rebuilding the strength.